course, my very special guest as usual. I should be calling him a guest. He's a regular part of this program. He's your friend, Dr. Llewellyn Johnson, there from Mandeville. How are you, my brother?
Oh my. Hi Vernon, how are you? Happy New Year to you.
Well, you should have asked me that question. You want me to tell you who am I? I feel like
Yes,
a motor car without
right.
gas. And all I'm
Mm-mm.
using is pushing the car from inside to drive at a reasonable speed.
Oh my.
I have been
Oh my.
knocked out completely with a horrible virus or whatever it is. They thought it was COVID, or there's another one I
Mm-hmm.
hear going around. Let me tell you, my friend, Doc, when I cough, you see, let me tell you, is that my chest was tearing apart. It hurt.
Mm-hmm.
And let me tell you, you start
What?
cough, you see, you can't stop, you can't breathe after that.
Mm-hmm.
Or the headache.
Mm-hmm.
And if that is if COVID is worse than that, then praise the Lord that I didn't have COVID. While I was at the hospital, I got another lady there. She seemed as if she had the COVID. So I thought that COVID was tired of Jamaica and probably only sent his cousin, but I hear probably cousin and first, second, and third is still around. What is
Yes.
happening, Doc? Because quite a number of persons are have this horrible, horrible flu.
Oh my. Oh my Vernon. What a way to begin. Well, I wouldn't say begin the new year, but we are in the first leg of the new year. And you have a but most persons would say you have a cold. But it's
Oh my
it's
word.
it's more
Now let
than
me
that.
stop you right here.
Mm-hmm.
Other persons enjoy a new year. It is clear
Mm-hmm.
to me every Christmas and New Year. And the
Right.
last time, as you know, a little most I head to Boneyard.
Yes, yes, that's true. That's
My
true.
younger listeners don't know what is Boneyard. So there's something about me, I don't know, but I'm still
Mhm.
fighting. And I suggest
Yes.
everybody to fight and still take care of yourself.
Oh my. The thing is, Vernon,
Yes,
um, well, if this may be any consolation,
yes,
you are not the only one.
right.
There was, from my standpoint, there was an increase in the number of cases of flu-like symptoms. This started picking up late September and it continued all the way through to November.
Right.
And there was a little dip between the latter part of November to the early part of December. But after the first week, there was a sudden surge in the number of cases that were coming in with these flu-like symptoms.
Mhm.
And with the increasing number of cases, we were still vigilant and still testing for COVID-19. As you rightfully said, Vernon, you're not really seeing a lot of cases, a very, very few cases of COVID-19 positive cases we're actually seeing.
Yeah.
And it's more of flu because this is really the flu season. It tends to start around about October, go out
Yes.
and straighten out into December, peaks around about December and up to March. There are some cases where it may even extend even onto May. You're right. Now the thing is, you heard me say that you probably some persons would say that you have the cold, but there are such subtle differences between a cold
Mhm.
and a flu and the flu. The both are really caused by viruses and different strains of the viruses.
Yes.
And the cold virus is mainly caused by the rhinovirus. Meanwhile, that of the influenza is caused by the influenza viruses
Hmm.
by the name given. So we shorten influenza and just call it flu, right? And so the some of the symptoms would be different when you compare somebody who has the cold versus the flu. Now, the cold would take its time and gradually build up. Meanwhile, that of the flu, it would be kind of sudden, a bit abrupt in terms of the onset of the symptoms. The other
Yes.
thing to Vernon is that you have more the cases tend to be more severe for persons who have the flu. The cold tends to be minor. And but persons who have the cold, they tend to present with mainly runny nose, itchy eyes and sore throat. Persons who have the flu tend not to have this. And if they do have it, it's quite rare. The persons who have influenza symptoms would tend to have a lot of fever, aches, chills, especially joint and muscle pains or
But
muscle
I
aches.
didn't have any of those at all. I didn't have any
Mhm.
joint pains. So I don't know. I'm wondering if they, or the tests were negative, but I'm still wondering if are they
Right.
really sure. And I'm wondering if there's something is going on out there that they're not aware of or probably not testing for.
Well, to be honest with you, Vernon, the flu, the viruses are very resilient. They are hard to
Yes.
conquer. And when you get rid of one strain, or once you think that there's a strain that is put to rest, there's another one that is actually formed. So it goes through seasons of mutations and changes. So even if it is
Oh,
that you clear yourself of some of these viruses, you still
yeah.
have them lingering. And so depending on what strain you have, that do presents with varying cases of symptoms, and it
Mm.
also depends on you as the individuals, on the individual as well. It depends on your immune status, or your how robust your immunity is. Some persons will have mild cases, and those who have very strong immune systems, and those who do not have that strong immune system will come down with a flurry of these symptoms. And the worst thing about it, Vernon, is not necessarily so much the sickness itself, is the complication that you can actually develop as a result of this virus not
Okay.
healing. And the most serious cases is really cases really fall under can result in you getting the bronchitis, or worsening your asthma, or you getting pneumonia. And are these are more sensitive depending on your age. So the younger the person, especially those under 2 years old, sorry, tend not to do very well. And those beyond a certain age, like those beyond 65 up,
Mm-hmm.
the immune system tend to be a bit weak.
And those
Persons
who
who
have
have
other
yes,
challenges like diabetes, high blood pressure,
exactly. Hmm.
yes. Mhm.
Right. So these are the more sensitive cases with respect to you having this disease. But once it is that you take your precautions,
Mhm.
you dose up with heavy doses of vitamin C and even zinc, it tends to limit its duration as well. And the duration of these tend to be between 10 days to 14 days, all right, of duration. But if it is that it's not getting better beyond 2 weeks, or if the symptoms are worse and they're having shortness of breath, I mean, you definitely have to seek the advice of a healthcare professional. Now, adding to that, now, Vernon, you mentioned, or you were even asking the question if something else is going on, but many tens of thousands, or many thousands of kilometers away from us, in a nice big country called China,
Yes.
there is an upsurge in their flu-like cases as well. And what they have discovered is that I wouldn't say it's a new kid on the block, but this virus, we call it the human metapneumovirus, is on the rise in China as we speak.
Yes.
And just like on this side of the hemisphere, where there is a peak
Hmm.
in the number of cases, especially those attending the hospitals, they saw a surge in the month of December. And this has been making some amount of headline news, because this is the place where COVID started from. So
Yes,
persons are
yes.
wondering if there's a new development that's taking place.
Mm. Let's have a
From
minute for
my
the break.
but from my standpoint, and from what I have read, there seems to be no seriousness or panic at this time.
Yeah.
It is not a notifiable disease, so it's actually treated as that of a common flu or cold. right? And so, right now it's as I believe that we need to, as a public, need to be very, very cautious, to take all the preventative measures so that we don't get to get this virus. Because really and truly, I'm seeing a lot of persons coming in, both young and old, and in the in between, complaining of the same, or more or less the same symptoms that you presented with, Vernon.
Mhm.
So when
Well,
we return, we would
gonna
love to
go
talk
for the
about.
break. Yes, we have to go for
Right.
the break now.
Hmm.
But I gather that we have had one death in the U.S. with the bird flu. If you
Yes.
heard about that. So, all right, we're gonna go
Hmm.
for the break. So we're gonna continue when we come back with the People's Doctor, Dr. Llewellyn Johnson. Welcome back. You're listening to Spot On with Vernon Darby, coming to you live from Kingston, Jamaica. It's Your Health, Your Wealth with the People's Doctor, Dr. Llewellyn Johnson. Yes, I was telling you before the bird flu has taken one life. I wonder if there's anybody in Jamaica has caught it as yet. I haven't heard anything about it. But they give you all. Let me ask about some of these medications. I really put you on the spot, doc. They pack up with all these antibiotics. This one is called augmentin.
Hmm. Right.
Um,
Well, Vernon, the thing
yes,
is, it, based on what you have been telling me, or what
yes.
you that you told me a while ago, it seems as though you probably had contracted some amount of infection on the lungs as well. I'm not certain if that's what the doctor had said to you,
Yes,
that there
yes.
probably is an infection on the lungs. And so, even though it's a virus-borne disease,
Hmm.
because it sets up inflammation in your lungs, it also causes the environment to change within your
Hmm.
lungs. And so, any any bacteria that lines that should not be there within the respiratory tract, I mean specifically the lungs, it can use that as a medium for growth, and then
Okay.
that adds to the level of inflammation and mucus production.
Mhm.
So the introduction of antibiotics is really there to counter the bacteria that is there.
There's another
Um,
one called, watch me try and pronounce it though. Benocit?
Benazit, yeah,
Benocit.
Benazit. Well, right. This is also another antibac antibiotic as well. So they are treating you for a non a community acquired pneumonia. These are classic antibiotic cases that we would
Mhm.
use in treating in treating infections of the lungs.
Yes,
And so these two work hand in hand in countering all the pathogens, especially the bacteria that's there,
yes.
that's causing you to feel so ill. How many days have you done so far?
Um, it was Saturday night, so it's Sunday, Monday, Tuesday,
Tuesday.
3 days, right?
Three
But the
days. All
feeling
right.
came on. How it came on first, you feel a little funny tingling feeling in
In
your
the
throat.
throat,
So I used the
right.
warm water thing, and it felt as if it
Mm-hmm.
was going away. But
Mm-hmm.
by about Friday, no man. Yeah. Then
Right.
they gave another one they called it. And this I don't know why. So I could never do medicine. These big words and these I could never. I don't know how you guys manage it at all. Ascoril. That's what
Oh,
is it?
ascoril, right.
Yes.
This is it,
Expectorant, right?
yes, it's a very wonderful cough syrup.
Yes.
It is very good in the case that it is a mucolytic agent, meaning that it helps to break up the phlegm that's sitting on your throat,
No, I
in
know
your
about
lungs.
phlegm. For me, they coach me about phlegm. No, I know it's a proper word. I thought
Exactly.
that people just made up that word, phlegm.
No, man, it's a phlegm. We use it as well,
Yes,
right? So
yes.
it's there to help to break it up, to
Uh-huh.
dislodge it, so that you can cough it up.
Right,
And
right.
it's also laced with other agents in it that helps to open up the airways so that it becomes wider, so you can take in more air whenever you're breathing. So
Mhm.
ascoril is a very, very, very good cough syrup.
But I was telling you, and
Anything else?
I must warn
Hmm.
our doctors and or I don't know if it's the doctor's fault or the pharmacist that we must always
Hmm.
ensure that the directions are on it. Because this one, for example, it says you'll be directed by the doctors to what the dosage should be. And there's nothing on it.
Okay. Well,
So
it's normally 10 milliliters or 10 cc's
that's about a
every 8
teaspoon.
hours or when needed. Well, it's almost a teaspoon.
Yes, yes,
Almost a teaspoon. But it's really 10 mils or 10
yes.
milliliters
Mm-hmm.
every 8 hours or whenever the cough is severe. It's
Mm-hmm.
3 times a day it should be used. Not normally beyond 2 weeks.
Now, one
Not
thing
normally
the
beyond 2 weeks.
pharmacist warned me
Mm-hmm.
about, and I'm sure I need
Mm-hmm.
to say it to you also, so you can remind
Mm-hmm.
us. They said to me, even when you feel better, continue to take the antibiotics. So, doc, now
Yes,
when you get
Vernon.
better, you can't bother take no more. We just stop
Yes,
take it.
Vernon.
Uh-huh.
Vernon. Look, I'm telling you the truth. I'm not going to be calling any names, but even some of my very good friends do
Yes,
admit to me that they are tempted in
yes.
stopping in mid of this treatment because they feel better. But I mean, they don't stop. But the temptation is there because they feel better, so you will want to remove it. But the thing is, there's a course that needs to be completed so that it can totally eradicate the the germs that are sitting in your system. And
Yes.
the thing is, you may be halfway through your medication and it probably kills
Mm.
95% of the bacteria. Now, if it is that you stop, that 5% that is there can learn or regroup and they can become even resistant to that same antibiotic,
By the way, you
right?
talk about these
It,
things like there are people, I hear about they mutate and they regroup. What are these things? They are
yes.
intelligence. And this is just amazing.
Yes, they are very intelligent. To be honest with you, it's a very sophisticated level of organization that they have. How it is that they're able to work together under certain circumstances,
Yes,
it's mystifying to me, right? But it's very, very interesting. But at the same time, even our bodies, Vernon,
yeah.
it's wonderfully designed and created so that even the most powerful computers don't come close to the workings that goes on within the cell of a human being,
Yes,
because there are
yes.
very many processes that's happening within one cell alone. You know, right, Vernon, and I'm
So
happy
so
that you
hold on. So,
mentioned this
so this
because
is very serious. So we
Mhm.
should never ever stop taking the antibiotics because we feel because oftentimes when we go doctor, we're brighter than the doctors and we know more. So we say, we get better, man. Rubbish. Tell the
Exactly.
medication.
And the thing is, Vernon, if you
Yes.
stop it in the middle, you can relapse. It can relapse. The disease or the pneumonia can come back on you with more vengeance.
Hold off. You see, me say that word relapse. When I was a youngster, that
Mhm.
word relapse was a
Mhm.
serious thing. Picnic come out of the
Mhm.
rain, man, you take up relapse and dead. Is it that serious?
It is serious, Vernon. It is very
Oh,
serious, especially Vernon, for those persons who we consider most vulnerable groups, those
hmm.
immunocompromised persons, like those who are suffering from certain medical conditions
Yes.
such as cancer, diabetes, etc., and the extreme of ages, and including those who are very young and very old. Those are the persons who we want to make sure that, especially those persons, definitely cannot miss the day. And in fact, some doctors, depending on the severity
Hmm.
and based on what the doctor sees in front of it, he may even extend the antibiotic to beyond a week, to go
Hmm.
even to 10 days, right?
Right.
So it's a number of things that the doctor will actually consider while writing
Oh, by
his
the way,
treatment plan for
make your
you.
final point and just so we can find you because time has run out of time.
All right, Vernon. Right. So, Vernon, we are in the flu season. We are still not out of it. It will go straight up until March. So, I implore our listeners to be very vigilant. And how we can be vigilant is continue wearing our face masks. Hygiene is very important. Washing our hands. And I would encourage that we carry a spray bottle with alcohol to spray the surfaces of where we work, the doorknobs, etc. If it is that we have these flu-like symptoms, it's best to take sick leave and stay home so as to reduce the contact. And while at home, if it is that you can isolate yourself from the rest of your family members,
Yes.
it would be great. And please stay hydrated. Drink lots of fluids.
Well, no,
Drink
no,
lots
no,
of
no.
vitamin C. Drink.
Let me not forget,
Yes.
yeah. This is vitamin C too.
Mhm. Exactly. And I want our listeners to drink the good old chicken foot, chicken neck soup whenever you.
Yes, I just had some a while ago, by the way.